So to my live and virtual audience, today I'll be sharing with you some information about the importance of oral hygiene and oral health and the effect that it has on your overall health and the importance that it has on society and something that society I feel like needs as a whole. I'll also share some oral hygiene education tips and tricks that can help not only get but keep you with a healthy smile. Do you have a dental home? Do you ever feel sensitivity or pain in your mouth or to your teeth? Did you know that a way that you can help prevent getting pain or sensitivity is to visit your local dental home and with your dentist and dental hygienist? It is recommended that you every 6 months see your dentist and dental hygienist in order for them to evaluate your mouth, your gums, your tissue, and your teeth. It's important to have a home oral care hygiene routine as well as a routine dental hygiene visits in order for you to prevent the progression of cavities and gum disease, because that by itself can also lead to other issues in the mouth and in the body. Typically, a 6-month appointment includes x-rays, a routine dental cleaning of your teeth. Also, it includes x-rays and it includes a routine dental cleaning. It also includes oral cancer screenings and x-rays. In the x-rays, they allow the dentist and the dental hygienist to see things that are going on internally, and it also helps them prevent and see and stop the progression of possible things such as cancer or cavities or periodontal disease. As a society, it's important, and also it's important not only to yourself and the individuals in the United States, but also as a whole for the wellness and overall, it's important for us to have good oral health, because without that, it causes a negative effect on us as a whole in the United States. Typically, according to Odo, dental care is essential to overall health, yet for reasons that are neither biological or policy related, dental care has been legislated as an optional service, although the mouth is integral to the body. With that being said, typically people have insurance, but they don't have dental insurance. So there are ways for people to get routine dental cleanings that are important for their overall health in ways such as the government has a couple different ways, such as Medicare, Medicaid, and CHIP, which is typically for children. There's also dental school clinics, and dental hygiene school clinics that people can visit that always have a license and overseeing dentists. And typically it's experienced dentists too that's been practicing for a really long time, that's licensed and that's overseeing the students to make sure that they are providing a good quality of care to the individuals who don't have dental insurance. And it also gives the patients an option for like a lower cost option if money is an issue. Another thing that people might ask is what are cavities and how do you stop the progression of cavities, or how do cavities progress? Cavities are typically present as a hole in your tooth, and if not fixed, the hole gets bigger, and it can also lead to pain or infection in your mouth. According to Sipage, cavities are 5 times more common than asthma and 7 times more common than hay fever. It's also preventable, yet 1 out of 5 children ages 5 to 11 and 1 to 4 adults aged 20 to 64 have at least one untreated tooth with decay being cavities in your mouth. Cavities over time are caused by poor oral hygiene habits, such as not brushing or removing plaque or biofilm, that's basically plaque on your teeth, or a poor diet, which is high in like sugars. That's typically the reason why most people do have cavities. In a regular cleaning, typically your dental hygienist will remove the things that you can't remove with a toothbrush, with floss, or with mouthwash. So that's why it's important for you to visit every 6 months, because you don't know what you missed with the toothbrush. But the dental hygienist can see through x-rays and through like exploratory instruments, things that need to be removed in order for you to have good gums and good oral health and a healthy mouth. The purpose after you leave, way after you leave the dental hygienist to get your teeth clean, you have to have a good at-home care routine in order to keep up with what they did at the office. Because if not, then it'll just lead to an never-ending cycle of like bleeding gums or pain or sensitivity to your teeth. So typically, the body has a good way of combating against germs and bacteria in your mouth. But in your mouth, you do need help. Well, in your body mainly, but in your mouth, you need help from your body needs help from yourself to get rid of the bacteria that lives along your gum line and in your mouth. So typically, an ideal oral hygiene routine includes brushing with either electric or manual toothbrush, 2 minutes twice a day. Typically, that's the goal. Also, flossing at least once a day is the goal. And then for mouthwash, typically you want to use no alcohol, but if you do use alcohol, you also want to have always have fluoride in your mouthwash. And if you don't have fluoride in your mouthwash, you should have it. But yeah, so you want to use no alcohol, because the alcohol typically dries your mouth out, and if you're already having cavities, it's not going to help you stop that progression of those cavities. In addition to a good at-home oral hygiene routine, it's also important to, another way to stop the progression is through sealants and fillings. The sealants are typically given to kids to stop, to eliminate the cavities from even forming, because typically it's laid on like the biting surfaces of the teeth and like the back region of the mouth, so that they don't even become an issue. And then the fillings are typically filled into areas in the tooth to the areas of the mouth that are cavities. And typically the dentist will remove the area that is decaying, and then they will fill that area with different types of materials. And they'll try to repair and replace the tooth back to like its original form the best that it can. But overall, it's important to have routine dental hygiene appointments and also a dental home and good at-home routines in order for you to prevent cavities from forming, and also prevent them from progressing. And also things like this will help you have a better oral health, and also that leads to you having a good overall health, and also it can lead to a healthy and happy smile. Thank you all for listening.